esophagus anatomy. The esophagus is a fibromuscular tube about 25 centimeters in length in the adult. It extends from the lower end of the pharynx at the level of C6 to the cardiac end of the stomach, which is at the level of T11. The esophagus shows three normal constrictions, and it is important to know their location at esophagoscopy. They are: number 1, at the pharyngoesophageal junction, which is at the level of C6 or 15 centimeters from the upper incisors. Number 2, at the crossing of the arch of aorta and left main bronchus, which is at the level of T4 or 25 centimeters from the upper incisors. And the third is where it pierces the diaphragm at the level of T10 or 40 centimeters from the upper incisors. The three constrictions of the esophagus. Foreign bodies in the esophagus can be held up at these constrictions. There is another description of the constrictions of the esophagus. Number 1, beginning of esophagus, which is at the pharyngoesophageal junction 6 inches from the incisor teeth, where the arch of aorta crosses the esophagus 9 inches from the incisor teeth, where the left main bronchus crosses the esophagus 11 inches from the incisor teeth, and at the end where it pierces the diaphragm 15 inches from the incisor teeth. The walls of esophagus consist of 4 layers. From within outwards they are number 1, mucosa, which is lined by stratified squamous epithelium. Submucosa, which connects the mucosa to the muscular layer. The muscular layer, which has an inner circular and an outer longitudinal fibers. The circular fibers at the lower end are thickened to form the cardiac sphincter. The upper third of esophagus has striated, the lower third smooth, and the middle third both striated and smooth muscle fibers. And lastly, the fibrous layer, which forms loose covering of the esophagus. Nerve supply of the esophagus. The parasympathetic fibers come from the vagus nerve and the sympathetic fibers from the sympathetic trunk.